big warm welcome to Sunanda too. Nice to see you. Um, as Sripriya mentioned, you're going to have an important session because this course comprises of everything. You have to master what is needed, like the knowledge, skill, everything, and then go on to setting up a practice or work in a practice and all forms. So whatever is your wish or aim will all be taken care of today by Miss Sunanda Samal, who is the regional coordinator for Central India for the Palim India State Facilitation Team. And she belongs to Odisha, but at present she lives in Pune. So she is not too far from anyone to help you all. And she has a master's degree in business administration and also in sociology. And she has a good solid 20 years of working experience in different sectors. And she has experience in healthcare for 5 years, and she has worked with UNICEF, which is one of the well-known teams. And she's done plenty of government projects in different states like Gujarat, Maharashtra, and Odisha. And next thing is the important thing. She is a multilinguistic person, looks like. She can speak 5-6 languages: English, Hindi, Bengali, Marathi, and Odia too. Okay, and that's with all that, I hand over to you, Sunanda, to take us through this session.
Thank you very much, Shripriya, and thank you very much, ma'am, for the lovely introduction. So, yes, Shripriya, do I have the sharing rights?
Yes, it is already there. You can run. And just adding, till the time she shares the screen, just adding that Sunanda is someone who speaks and understands the language of heart very much, which is not mentioned in the slides.
Is it visible?
True, Sripriya. I will also second what you said. She is a very good human being.
Correct.
Thank you so much. I'm overwhelmed. 1 minute. Is it visible?
Yes, I think you shared.
Yes, we can see your screen, Sunanda. Go ahead.
Okay.
The presentation is on.
Okay. So, good evening, everybody, and welcome to this.
Can you put it in slideshow mode?
Yes,
slideshow.
1 minute. Is it okay now?
Yes, perfect. Good to
Correct. Okay. So once again, good evening to all of you, all the participants here. I'm glad that I'm getting this opportunity to interact with you all. It's a real privilege, and I would not waste much time. I'll just go ahead, and I just wanted to start with what is actually state facilitation team doing. So I belong to the state facilitation Palim India. So I just wanted to briefly tell about the state facilitation team. So we, as a division, we try to take the work of Palim India across the country, like to various regions in India, with a vision to facilitate access to palliative care to all those who are actually in need. So in the forthcoming slides, we'll get the details. So this session will actually briefly tell you how you can open a palliative care center in your region, as Shripriya was explaining why this session is important. So you may be already part of some hospitals, or individually you have some clinics of your own. So we shall guide you on how to start a palliative care service in your setting. So later on in the Q&A session, we can have some queries. So, okay. Let me just go ahead. So this is, as we can see, is a triangle, which is saying that it's a WHO palliative triangle. So we'll start with this. So this is the WHO palliative care advocacy triangle. So as per the WHO, to set up a successful palliative care center, to organize a palliative care service, we need to ensure 3 basic things. So as you can see, there are 3 corners. We have education, drug availability, and policy. Okay. So I just move on to explain each point. In education, as we all will agree that there are various barriers to palliative care, which we will have to overcome through education. And we all know that there's a lack of awareness among professionals, lack of awareness among the administration, lack of awareness among the public. So essentially, we need to educate the public. So public demand does persuade professionals and administrators to think. So that is why education or educating people of all strata on palliative care importance is very important. Second, coming to the drug availability. So pain relief, as you all know, is the integral part of palliative care. And for that, availability and accessibility of pain relief drugs is necessary. So morphine is a mainstay of pain management, we all know. Its availability has been eased to a small extent by amendment of the NDPS Act in 2014. But we regional coordinators, after interacting with the different states, we came to know that there are some states that still have not implemented them. So we are struggling. We are trying to convince them to implement. So the last part of this triangle is the policy. So when we talk about policy, we also are trying to tell about how it can be implemented also. So in much of the world, like we all know, palliative care came into being because of individual initiatives and action by some NGOs. However, to achieve a national coverage, palliative care needs to be integral part of general healthcare delivery system. So government action actually is important to remove barriers. I think we all will that we need government support for this. It is essential that for budding services to develop their own policies that can overcome any gap in the available facilities. I'll just give you a few examples. There are, I have interacted with many of the hospitals or organizations. They do have wonderful services, but they are struggling with the procurement of the opioids. So that's how we, help them to procure, and so that smoothly they can have the ENDs, the essential narcotic drugs with them. So when we plan a palliative care service, we have to remember that we should have trained people, like the trained team, and we should definitely have the opioids available, and there should be a policy or a program available to support your service. So I think this triangle is well explained. That is the basic thing about this triangle, the WHO palliative care triangle. So let us just move on. Just give me a minute. I'll just stop sharing and come back. Is it visible?
Yes.
Yes, from the first slide, not in slideshow.
Yeah, I'm just going. Okay, is it now visible?
Yeah.
Yeah, okay.
And it is moving as well.
Yeah. So, okay, now moving on to the next slide, as we all can see, it is, let us discuss how in Indian context, we can, talk more about palliative care services center. So, the first one, as you can see, we talk about the standalone or the hospice or a palliative care center. Then we have, so the standalone model is actually an independent facility where we provide palliative care with specific focus on pain and symptom management, and of course improving the quality of life for patients and their families. So this can be done through a hospice or a palliative care center. So that brings to the first point of this particular slide. So the next one we're talking about is the department or a particular unit within a hospital. So when we talk about a hospital, it can be a government hospital, a charitable hospital, or a profit-making or not-profit, or a sustainable. And the third here, we are talking about the community-based home care. So when we talk about community care, there is a community, like when we say community, definitely the community is involved here. So here what we do, we reach to the care receiver. The care receiver doesn't have to come to us. We reach them where they are. And here the social capital act as a bridge between the micro and the macro. We'll just come to know what is the macro and micro. And the major element of this social capital is the volunteers. So basically in community model, the volunteers are the players. They play a major role in this particular facility. So here are some pictures of the standalone facility, the hospice. So the first one is Sipla. Here is a Ruma hospice, and below there are some of colleagues who are working in different other regions. So these are the standalone hospice that we work with. Here are a few more, which is one is Institute of Palliative Medicine Calicut, other one is Karnashray. Okay. Now coming to within a hospital. So as we all know, in a hospital, we have a dedicated room for palliative care services, either OPD or IP, whatever. So these are some of the pictures of with whom we work. Okay. So as I was just talking about the micro and the macro, these two words, I'll like to explain how we work in this community. So in Indian context, the macro components, which here will be the tertiary health care institutions. So what is happening? They are getting bigger and bigger. Okay. And the macro components and the micro components, the beneficiary is not able to reach them. So this is where the community concept comes into action. So as you can see in the middle, there's a meso. So which we call as a meso component. They take ownership of bringing the micro and the macro together, thus bridging the gap between them. Micro, meso, and the macro. So now in Kerala state, has utilized the power of community model. We all know Kerala community model is quite famous, and people, know about it very well. So which might not actually work in the setting where you all belong to, but anyway, we would like to bring this as an example or a prototype, which you can get an idea at least, and you can go forward with setting up the service. So, okay. So since we're talking about the volunteers and the importance of volunteers in the community model, I would like to just highlight about one of our very dedicated volunteer. His name is Mr. K.N. Nair, but actually we call him Nair Uncle. So I'll just little bit explain how he, came in touch with us and what actually happened. So he is a 70-plus-year-old and he's an ex-serviceman. So he got introduced to Palliative India as a caregiver to his wife who was under our care. So he serves as a volunteer after his wife passed away. He goes with one of our home care teams and is involved in patient care more than our clinical team. So he is actually very, very dedicated. He's known to our beneficiaries also more than our team. So he has a small notepad in which he keeps all data of the patient and keeps in touch with all of them over phone almost every day. So our beneficiaries are actually very comfortable to call him or to talk to him about the issues. He's never ordered to do any of these things from our end, but he feels that whatever he's doing is, is his duty, and he loves doing it. So he also does the follow-ups, and he does it as if it's his responsibility. So I think this is a brilliant example of a volunteer, and I think in this particular setup, we would like to highlight that yes, we all will agree that volunteers' role is very important in this kind of services that we are working. Okay. So as we're talking about how to start the center and how to proceed, so we have just given a 10-step approach, as you can see in the slide, where I'll just quickly explain how we are doing it. It's very self-explanatory. Still, I'll just spend a little bit more time on that. So this is actually the crux of this whole session that we are taking. So it's a 10-step approach. It's just a basic law that you follow. It's not a concrete rule. And it may vary from one setting to the other. So just, I think we'll go one by one. Now, first is, as you can see, is the arrangement of the funds. So before starting any organized, like any kind of services, we have to actually think of the funds. And if you're part of any government hospital, there are funds available through various programs like NPPC and Ayushman Bharat. For private, of course, you can create the service and you can charge for it. And it's for the charitable and individuals where the actual challenge is. For them, we can go for the CSR or the public donations. So you should have an idea which source actually you'll be opting for, depending on where you're going to start this particular service. Coming to the next point, as you can see, we have to recruit and train a team. I was also telling you a little bit before that we need a full trained team. So another important thing part is a trained team. So initially, you can have a doctor, a nurse, and a social officer, social worker. So going forward, as you grow, you may require some allied medical professionals like pharmacists, physiotherapists, occupational therapists, dietitians, etc., depending on what all services you're wanting to include. So as a basic unit, we need a doctor, a nurse, and a social worker who should be trained in palliative care. So next thing that we would need is an infrastructure, of course. So it can be a room for OP, or space and furniture for inpatient unit, or in case of home care, a vehicle, which can be used by the team to travel to the needy with all the essentials like medicines and other consumables. So this is the next point that we need to take care. Then the arrow moves to procure opioids. So I was just telling you that why it's important. So we all know that we all agree that availability of essential narcotic drugs for pain relief is required. So to procure, store, and dispense opioids, you need to be a part of a recognized medical institution. In short, we call it RMI. So it's a lot of information required for understanding this topic. So you'll have a detailed session on opioids availability during this program for that. So I need not spend more time in that. So only one point from here is for procuring, you need a license. If it's a government, then you are deemed RMI. So you don't need to apply for RMI. But if it's not a government setup, then you need to apply. Then coming to network building and establishing connects. So definitely you need to establish connects with existing experts in palliative care in a region. So this will help you to understand the local challenges and support them. So accordingly, you can, add on to your services, looking at the what is the requirement of that particular region. So for that, I think the next point is very clearly said, that creating awareness. Okay. So we need to arrange awareness sessions for the public as well as the team to help them know about palliative care. This will help you to get referrals as well as identify local champions who can take your work to more people. So that's the reason why awareness is going to help us in the long. Now coming to developing OPIP and developing home care services, the three in one. See, so for developing OP, maybe you can have a local hall, classroom of a school, colleges, or a room if you're part of an established hospital. So just ensure that all the facilities that you find should be disable friendly. You can just have an examination table, a chair, and some basic furniture and essential medical equipments for conducting an outpatient unit. Similarly, when you are talking about, suppose you plan to have an inpatient facility also. So you will involve a little more infrastructure in terms of beds for patients, side lockers, etc. I think you know better than me for this. So a center can also operate, like if you want to start with only OP, that's fine. In due course, you can add on to IP. Or if you are equipped enough, you can start both. There's no hard and fast rule that it has to be both, or it has to be one. It can be anything according to your resources. So now moving on to the home care. So you can start with one vehicle, which can accommodate the team of doctor, nurse, and a social officer, and medicines and consumables. So these are scenarios where just a doctor or nurse, go on a two-wheeler for home care also. So, but it's just the passion that drives. So ideally, we would say that it's better to have a vehicle, dedicated vehicle for the home care team. So now coming to the involvement of volunteers, you can see the last box, it says that involve volunteers. So I think we have understood by now that why volunteers involvement is important. So this is the basic flow that we follow, but it's, as I said, I want to repeat that it's not concrete. It's nothing as a rule. So it may vary, and you can just customize it as per your requirement. Moving on to the next one. Yeah. So here, this is actually strategy for financial delivery models. So it is, we have to just look how we support and facilitate palliative care services with already discussed models like government, charitable institutes, for-profit models, and sustainable models. So in capacity building is actually, it's one of the major support that we are providing to our stakeholders. Like we conduct various workshops, orientations, foundation trainings for doctors, nurses, health workers, training of the faculty of, curriculum, training and engagement of the volunteers and community. Then specialized trainings for physiotherapists, pulmonologists. In government, we support in training the ASHA and the ANMs also. So in capacity building, we are catering to these many things. Now coming to the opioid availability. So we support in getting the NDPS Act implemented, which includes, we also do the awareness for medical institutes about the new RMI process. I was just talking about the RMI, which is a recognized medical institution. And we also help them to apply, like we share the documents, what all are required, the forms, and help them to submit the application with the state drugs controller. We try working with NHM also to get opioids included in the state's essential drugs list. So the second part, we are doing these many things. Then we also do hand-holding for the palliative care unit at district level, connecting with local palliative care networks. We provide documentation assistance and support. Suppose anybody is wanting any kind of documentation assistance, we help them out. Also, we do developing program implementation plan, that is PIP for the state, implementation of NPPC, development of palliative care through health and wellness centers under Ayushman Bharat scheme. Parliament contributes towards developing a state palliative care policy also. We do have regular connect with the Ministry of Health and Family Welfare for developing palliative care in the states. Then we help in recruiting human resources for starting a palliative care center. We facilitate cost management and sustainability. We help build funds through donations and help in grants and CSR application. So apart from all this, now we have a new process called the implementation team support. It is called the implementation team support, which means where we send an implementation team of a doctor, nurse, and a coordinator to your site. So they'll stay with you, handhold your team through the process of setting up palliative care service for a given period of time, which also includes, like it is, it will have some cost. It's not free of cost. So that's how we contribute to this, having the setups. Coming to the next one. So here, since we are discussing a lot about having a new setup, new center, so definitely we all know whenever we start something new, we do come across some challenges, somewhere or the other. So we have just listed it out as per our experience. When I say our, it's just like me. I'm the regional coordinator for Central India. I have other colleagues. So we all had a discussion and we just penned down these particular challenges. As you can see, availability of funds, sources, and safe place for the procurement, because for the procurement of opiates, actually we are facing the biggest issue, because people are actually not interested to apply. They are happy with the current license, and some feel that it's not very lucrative business, and so on. So you can just have a look at these points. So we have just segregated, and with the one side we have put the government, the challenges with the government. So these are the points that we have discussed and did. I just want to ask Shripriya, are we having a Q&A session later, right?
Yes, we do have, but in case someone is having any
Yeah.
pressing questions, maybe you can also take up.
Yeah. So
Of course, we have time allotted for Q&A.
Correct. So in case and Shripriya, please have a look at the chat box also, because I'm not looking at the chat box. If there's anything, do let me know. Yeah. Okay. So as you all can see, challenges we have. So I think we will discuss more about the challenges in the Q&A session, because I'm very sure you all are from different parts and you must be also facing some new challenges which is not listed down here. So we would like to know that, because I think it will help us. I mean, I can share with my colleagues also that this can be also one of the challenges which so and so person had shared. So that will be good if you can share. Moving on now. Okay. So here, this is a standard audit tool. Shripriya, this will be shared with them, right? The link and all?
Yes.
Yeah. Okay. So I'm just keeping it brief. This is a kind of actually self-evaluation audit tool for palliative care centers. Once a center is ready, so how do we assess ourselves? There should be some tool, right? Some audit to assess ourselves, to know where it is standing, how we are, what is our standard, how we are doing, where we need to change, where we need to improve, So there are actually two parts here. So one is the part A is essential. It's actually, the font is very small. I don't know if you all can see that. Part A is essential and part B is desirable. So in the essential, it is like the minimum requirement that a center should have. So the ones listed in the desirable are the regular requirements. This is the link to the original document. So it will be shared with you all by the team. Okay, so this is very beautiful tool, and many of our stakeholders who have started of their own, with our guidance, they have started the center, they are using it, and they find it very, very user friendly. And it's really quite a good tool. Okay, so I'll just move on. Okay. So when we talk about Palaminda model, people keep talking Palaminda model, Palaminda. So what exactly is it? So this is our picture that we always use in every training to explain how we work. So this is actually, we call it the DEF model. If you look at the right-hand side circles, we have D, demonstrate, E, educate, and F, facilitate. Okay. So, so the left-hand side is, because as you all know, the TIPS is in Trivandrum. So, and it's a community charitable model. So this is a WHO collaborative center. Okay, the TIPS is the Trivandrum Institute of Palliative Sciences. And then we have the link centers in OPDs, which is managed by the volunteers and at the community level. Then we have the home care. So now let us focus on the D, which is the demonstrate. So what we do, how we demonstrate. So demonstration model is proof of model that we take to our stakeholders so that the potential stakeholders like you all can learn how to deliver palliative care. So here we have the tips. So tips is which is in Trivandrum, which is Trivandrum based. So there, which is also, as I said, is a WHO collaborating center for training and policy for access to pain relief. So that means if somebody wants to come and see how Palamenda works, what is their model? So like we are demonstrating. So you have to come down to tips, come down to Trivandrum to look at our work. So that's, we call it as a demonstration. Okay. So as you can see, there's a there's a chain which is working, like it is from Thiruvananthapuram, from Trivandrum, it's moved to the national scale up. So we demonstrate at the national level also. Okay, so now since we're talking about demonstration, let me just explain. So what we have in Trivandrum Institute of Palliative Science TIPS, which is a WHO collaborative center. So we demonstrate inpatient care, outpatient care, government hospitals, home care, rehabilitation and reintegration, community participation, link centers, halfway home. The halfway home is very beautiful. Like we actually support paraplegia and quadriplegia. I would request all of you to plan a visit definitely to Palamida office, and because it's better, to go and visit yourself and see the work, how team is working. So here we have some figures like how many patients we have reached in Trivandrum and how many volunteers are there, how many link centers are there. These are some facts and figures. So in demonstration model, this is our demonstrating center, which is in Trivandrum. Okay, so just to break the monotony, we have a beautiful slide which says that there's a helpline for palliative care, and you can see the numbers, you can see the days. It's Monday to Saturday, 9:30 a.m. to 4 p.m. These are the languages that we have. So you all can take a screenshot or take a number and please circulate, so that people can take advantage and help of this particular telehealth. So I just want to specify here, because many of our stakeholders get confused how this number works. I'll just tell you because I myself had tried one. So what happens when you call this number? It'll work like an IVR. So you call them and then you have to, after the beep, you have to give your details or whatever is your question or query, and then the team will get back to you. And if it is after 4 p.m. you have called, so still the team will get back to you the next day, because as you can see, we have the limitation of time. It's not 24/7. So before 9:30 and after 4 p.m. you have to have a little bit patience. The team will definitely get back to you. And people, what they do, they tell us that no, the number is not working. Actually, they don't realize that there's a beep sound, and after that they have to do it. So please take a note of it, and whenever you use this number, please just keep that in mind. Okay, so moving ahead from the helpline to the next one. Yes. So now here we'll just talk about the education, and the next circle is about the education. So in education, TIPS has this training programs. So we have for the doctors, we have FCPM and CCPM. FCPM is the one which you all are taking right now, which is online. CCPM is the on-site, like doctors go to the Trivandrum center. And similarly, we have for nurses, we have for allied healthcare professionals. And I want to tell you, this FCPC is a beautiful program. Like this is for non-medicos, anybody who is also interested in this field, but not a doctor or a nurse can take up this. And the best part of this training sector is the volunteers training. In this VTP, we have general public. Anybody can take the training, be it a student, a housewife, or a veteran, or a ex-serviceman, or a retired government officer, anybody without any educational background but they just have to have interest to work in this field. So we have this training, and this volunteers training is free of cost. It's also certified. Other courses are paid and certified also. So as you can see, there's a list of training programs. So as and when we have new training programs added, we'll let you know. So moving on to the next one is the facilitation. The last circle is the facilitation. So which is what my team is doing, like where I'm working with that team. So I'll just explain a little bit more about facilitation. We have 4 regional coordinators. In North, we have Mr. Rajendra. He's based in the Uttarakhand. He looks after the northern region. And in Northeast, we have Rontu Sangma. He's based in Guwahati and he looks after the northeast part, especially the Seven Sisters and West Bengal. So, and it's me taking care of the central region. So I'll just spell out my states. I'm looking after Maharashtra, MP, Chhattisgarh, Goa, Gujarat, and Orissa. So if any one of you are from these states, you can feel free to contact me later on if you plan to have a new palliative care center, or for that matter, any other queries related to your region, which I'm looking. And in South, we have Lalit, who's looking after all the southern states. So I think our training team will share the contact details of all the coordinators in the chat box, and you can get in touch with them if you have any region specific queries or any facilitation help required. So this is about the facilitation team. Yeah. So here just to give you a clearer picture, as you can see, the first map is about the North. So Rajendra Dutt Vijalwan is the regional coordinator for the North. He's looking at these states. And towards the right, you have Northeast. Rontu Sangma is looking at these states. These are the states after. And this is me, the central part of the country. So these are the states marked in green. And the South is taken care of by Lalit. Okay. So now I think we'll move to the philosophy of state facilitation division. Why this division and why, what is our philosophy? I would like to little bit explain that. So this division, we aim to integrate palliative care in all the 3 levels of healthcare, that is primary, secondary, and tertiary. And this department, our department, State Facilitation Department of Parliamentia, has basically 5 main objectives that drive this facilitation division. So first one is to catalyze palliative care centers and services. So what we do in that, we help them end-to-end facilitation for catalyzing centers across various categories like government, charitable, sustainable, and for-profit organizations. So here I'd like to just quickly give you an example. Recently in Navi Mumbai, we have Fortis Hospital. I'm sure you must have all heard about it. So it's a private hospital, but somehow they got in touch with us, and then they decided that we already have a OPD, but we would like to have a OPD for palliative care special. So then since I'm looking after Maharashtra, I visited them, I interacted with the team, and then I found out that they're not trained. So once, the team was ready, and then they were trained online. So it took almost 2 to 3 months for the training to come. Then I followed up, and then one fine day, like they decided to open after the training was over. So decided to have a formal opening of that particular center. So now it's running, and now my next step is to help them in getting the license. So when I say end to end, this is what I meant, like that, from starting from scratch to end. And also once it is ready, we will not leave them, like we'll keep following up. We'll see how more patients can come in and how better they can serve as a facility. So the next one is we also assist them in opioids accessibility, as we were discussing earlier, that how this is. So getting certified as a RMI institute, there's a long procedure that's involved in this which you'll all learn through opioid awareness session later. So we help our stakeholders to go through each documentation. There are a lot of forms and documents and what all things they have to submit as attachments. So starting from filling out of application. We also do the handholding for how to fill the application. So talking to the drug controller, maintaining the record. So as regional coordinators, I want to mention here that we have two major government departments to visit, which is mandatory for us. One is the health department of each state that we're looking after, and the second is the state drugs control. And needless to say, why we are focusing on these two departments. So when we are going to the drugs controller, we are first finding out that whether that particular state has already issued RMI or not, whether they're implementing or are they still following the NDPS to the old license. We need to have interaction. If they are okay, then okay, fine. If they are not yet started, then we need to have a meeting or a workshop with the whole opioid, with the whole drugs controller team. So that is the first requirement. So that's how we, ensure that any palliative care center or any hospital was, is feel and need of opioids and are not able to procure, we help them. Now, coming to the next, we enable palliative care learning in medical institutes. So as we know that education plays a major role in delivering palliative care, we try to work with medical institutes to involve palliative care in their undergraduate curriculum. Here we work with the trainers, then they train the students in palliative care. So what we do, we train the faculties basically. Okay. So this is the thing. Then we work with stakeholders to help them build community engagement and help them mobilize volume. This is also a very, very huge responsibility. So here in Parliament, we create awareness among the public, get similar interest people together, then they form a group as in link centers and they take ownership of taking palliative care across their region, which is actually really, really commendable. And wherever I have been to whichever states I've traveled and whenever I talk about this, they all really want to, replicate if it's possible. Recently, I had been to Orissa to some of the organization I met. So they want to come down to Parliament to see how the community model works. So it is actually people are wanting to do it. So that's how we help them. Now there's one more concept called developing pain-free hospital. So what is a pain-free hospital? So this objective is in actually budding stage. We have actually not really worked too much. We're just starting it. So here we try to develop a hospital wherein any patient that enters for any treatment is assessed or treated by the pain score that he or she has. Pain score is measured by a scale which ranges from 1 to 10, 10 being the highest. So this is actually, we are still working on it. So with this, this slide is done, and I'm very sure that I have been successfully explaining the slides. Moving on to the next one, if you do not have any questions. Sripriya, is there any question in the chat box?
There are a couple of questions in the chat box, Sunanda. I'll
Okay.
just tell them.
Sure.
One is they've asked you to explain meso and micro once again.
Once again, okay.
And then the next one is, do they need to get prior government permission if they want to start a palliative care center? These are the two questions in the chat box.
Okay, so I think I'll quickly answer that. First of all, there is no requirement to take government approval before starting a palliative care. If it is a, if it's a private or it is your individual thing. See, as I said, government the government, they have district hospitals where it is mandatory that they have to have the palliative care centers in all district hospitals. But in other cases, other than government, you don't actually need to take any prior approval for it. You can just start off. So that for that we have a guideline, how to start a palliative care. So you can get in touch with your concerned regional coordinator. They'll guide you. We'll share the guidelines with you. You can go through, and if required, still if you need some clarification, we can have a Zoom meeting to explain that. I think I've answered that question. Is that clear?
I think I'll just add on something.
Yes, yes,
Sunanda.
please.
Basically, see, as Sunanda has explained, if anybody wants to start off a service, they can get in touch with Pallium. Then through your regional coordinator, everything they have a sample. Like even what are the things that you need to procure, they will help you. So, but see the interest. If you go in that 10-12 box model which was explained, that one is very important. So if you've got the funds, everything, because without anything you go step by step following the model. Pallium will help you to take you through. For example, if you want to start something, I don't know how much I need. Okay, for 10 patients or 10 inpatients, outpatients, something like that. So they will give you some rough estimates. If it is for 10 patients, just use that. If you're going to have for 30 patients, multiply that into 3, something like that. So there are already made structural pattern, as she said, some guidelines, everything is there. So they will help you to set it up. So that is how your interest, funding, everything, you have funding place, everything is there. Then you come. The thing is that even for that you want guidance, they will help you. So you have to get the initial bit done and then approach, and then accordingly they will take you through. And depending on the region. And ideally, I think I think I told in the previous session also, best is for you to do some 5 days or 10 days hands-on in some nearby palliative care center. I think even that, Sunanda, before she finishes, she will tell you, there are like 40 to 50 recognized palliative care centers all over India. So you can find which is the one nearest to you and go do the hands-on to get an idea. So if you see something, will give you more insight, and then you can plan accordingly. That's it, Sunanda.
Thanks a lot, Radha ma'am. Yeah, that was important. Yeah, I'll definitely tell the hands-on training process. Okay, so as per your request, I'm going back to this slide, the micro, meso, and the macro. So I'll just explain once again. So actually the community-based home care, or the community model, the difference between a regular home care service and a community model is the mode of delivery. So in Indian context, the macro components, as you can see, the macro, which is nothing but the tertiary healthcare institution, they're getting bigger and bigger, means it is becoming out of reach for the beneficiaries, those who are poor, those who can't afford. So they're not able to take the facility. I mean, they don't have the access over there, they can't afford it, to be very, very honest. Okay. So, and the micro element and the beneficiary, here the micro element is the beneficiary. As you can see, there's one person standing. So this is the facility, this is the person. So this person is unable to reach here. So this meso concept came in because this is a community model. So what is happening in community model? The facility is going to the patient. See here, the team is reaching. This is the patient. The team is reaching. So we just named it like that. So the meso component is the bridge. So they're taking the ownership and they're bridging the gap between, so that at least the facilities are available for the people who can't reach the hospital or the service center. This is important. And in Kerala, we do it. Most of our services, home care services, are like this only. Like we have, dedicated home care teams. Every time they go and they reach the person, and if you sometimes have the opportunity to come down, you can see how difficult places they reach. It's not very smooth sailing roads. It's difficult terrains they go. So that's why we are highlighting on the community.
I will just add on one thing, Sunanda.
Please.
See, macro is like total palliative care service itself can be 2 types. Okay, one is the inpatient service, where that is a hospital-based palliative care. Sorry to say inpatient. It is called as hospital-based palliative care, where everything is available inside the hospital. That's what she said. It's a big, full tertiary center has everything, has a palliative care psychologist, oncologist, radiation, everything is there in one place. Okay, that is one. And then the micro, basically that's a patient. Home care is one which links. Basically, home care and hospital care both are palliative care services. A hospital based care is in one place. You have to go there. Whereas a real palliative care patient is unable to move, cannot get to the hospital. So the home-based care, there again in that you have a community nurse, you have doctors, psychologists, physiotherapists, and all the whole team is there, but they will go as and when needed. So the hospital going to the patient. So that is what it's as she said, it's the bridge between these two. And for that to happen, no, you need for that only is again and again we'll be telling the same thing. Don't get upset. You have to see to believe. In Palliam, every day 7 home care teams go. 7 vehicles move out of the unit. Okay, so each unit, each vehicle will have all facility. But every day there may not be a doctor because sometimes it may be just for nursing care. So like that, it will vary, but they have a full team. So that is that the whole hospital going to the patient is the intermediary model. And there's one more question in the chat box, Sunanda, that is about just starting. Can we start only private OPD model, like OPD setup for medicine, etc.?
Yes, the question is, can we start only private OPD model like OPD setup? Yeah, you mean OPD, palliative care OPD, right? I think
I
that's
think
what,
that's what.
yeah.
Yes, I
So
think
yeah,
that's
just
what.
like I
But
gave the example. Yes, ma'am, go ahead, please. Radha ma'am.
You go ahead first, Sunanda, then I will
Okay.
jump in.
So this question is what I understand is that you're asking, yes, palliative OPD. Good, good. So as I said in this Navi Mumbai, the hospital, Fortis, it's a completely private setup. But still, they thought that no, we will start a palliative care OPD specially. So they went ahead, like we guided them and they completed the training. So that's what it is. You can just have OPD. No need that, or if you want to start up a center, you have to have all the 3. You can start with OPD. Later on, looking at your response and the facilities that you have and your resources and your strength, you can expand it to IPD also. So not an issue, ma'am.
Yes, so it all depends where you want to start an OPD. But once you start an OPD and run an OPD for like 1 or 2 months, you yourself will come to a conclusion that you need help from everywhere. Okay, but ideally best is to start off with an OPD for you to get an idea. What is the number of patients you'll be seeing? What are the types of patients you'll be seeing? What are the facilities that you need to cater the service? So basically, all these things are essential for you to know what is the type of patient you're going to be getting. So you can start, but even for that, basically you need the training, and you will need at least opioid availability. Once you
Yes.
start a service, bare minimum that is.
Correct.
So that it all depends. So again, if you're going to start in a hospital or like a private thing by yourself and all, you will have to go see and be prepared for what is the experience and skill limit you have to face everything. Are you going to do it all by your own, or are you going to do it in a hospital setup? Everything matters. And then accordingly, based on what is your need, Palin will help you to bring it out positively.
Correct, ma'am. Thank you so much,
Hope
ma'am.
Hope your queries are clarified. You can go ahead, Sunanda, and then we'll come back to the rest of the questions.
Yes. So I think I'll give another example to clarify how things can be customized. So recently, as I said, I had been to Orissa. So there is one NGO working in palliative care called, name is Amrit Dhara. So I got a chance to visit them. So they have, something called daycare. They don't have IP. They have daycare. They have home care. Okay, so they have chosen because they have limited staff or limited resources. So they have a home care, and the home care, like they have just one team, and they do not have vehicles. So just I'm trying to give you an example how even with limited resources, people are starting, they're making efforts, because in Bhubaneswar, it's a state capital, still we just have hand counted centers. So they thought, why not we'll reach to people? So they're catering to complete capital of Orissa, that's Bhubaneswar city. And with one team only, they do not have vehicle, they are going with the Ola and I was lucky to be there on the day, and I also traveled with them to two patients in Bhubaneswar. So this is a very good example to pick up that there's nothing mandatory, like you have to have this much. So you can just pick up, as Radha ma'am was also saying, that, okay, you have the intention to serve, and this is the thing, and you can start with OPD, you can start with daycare. So they have the daycare, which is a very a nice thing, because they do not have staff to look after the patients 24/7. So they said, like, let's have daycare. So I just wanted to highlight that. Okay. So if is there any other question? Yeah. Apurva ma'am, you have raised your hand.
Ma'am, is there a specific set of people that should be there in the setup? Like they need minimum of 5 nurses and 3 doctors or whatever. Like, is there a specific set of number that is required to start with with an OPD or an IPD, or like somebody who's certified can right away start with the palliative care medication and the care that needs to be taken, or there has to be a guided setup that needs to be taken care? That is one thing. And any license that is required to start with the practice, or any practitioner can start doing it?
Yes, very good question, Apurva ma'am. May I know from which part of the country you're talking? You're there?
I'm from Mumbai.
Oh, very good. So I'm the person. So I'm talking to you. So okay. So what we'll do is I'll quickly answer your first question. Is that how many team members we need? So the minimum that we tell everybody is 1 doctor, 1 nurse, and 1 social worker. The minimum is that. So you can expand. You can recruit more people, but the thing is they have to be trained in palliative care from wherever. It's not necessarily from Parliament you have to be trained. So it has to be a certified course in palliative care, all the 3 people. Like if I take example of India, for doctors, this is a course we have, as I said, FCPM, which you all are taking, and for the on-site you go to Trivandrum for the other course for the on-site. For nurses, we have FCPN and other courses. For the social worker, we have the FCPC and other courses. So the first thing requirement is a trained team. Just like I was telling you about Fortis, so they had to first train. Though the team was ready, but I found out that none of them are trained in palliative care. So this is first. And the second thing is that we were asking about the guideline. As I said, I think you can take my number, from the chat box, and we'll connect. I'll guide you completely, and we will talk one-on-one on that. Is that okay?
Yeah. All right, sure. Thank you so much, ma'am.
Yeah, thank you.
Well said, Sunanda. I keep telling everyone, this is the bare minimum.
Yes.
1 doctor, 1 nurse, and 1 social worker. Because without these 3, if you start, you will get upset. Okay.
Yes.
Basically, why we are telling this 3 people component, there is a reason to this. Because all 3, whenever you see a patient, you've all had like nearly 15, 16 sessions. We keep on screaming, total, total, total. Yes. If you are going to be on your own and you get a patient with stage 3 bed sore, first you need a nurse. And then they may have some social psychological issue. They may not even open up, some financial. So that local area, what is the problem in the house? So at least bare minimum, these 3 people needed to have a comfortable, smooth running of the service. So that is why. So, and then all 3 need to be trained to know what is palliative care and move forward in a nice way from that. There's some other, after this training, are we qualified to train? Yes, if you are willing to train, you can. That's why she did mention, no, you are getting trained. If you are very happy and go train someone, really well done. That is the aim.
Yes, ma'am.
Okay.
Thank you, ma'am.
Go
Yeah.
ahead.
So, okay, now let's move on. So now, as you can see in the slide, is it visible? National presence slide? Yeah. Okay, so just quickly to give you some data on where we have worked. So we have worked with the NHMs and state governments for the facilitation team, and 26 states and 5 union territories we have covered. And palliative care training centers catalyzed, like just we are talking about the same topic. So we have done it for 5 sites, and on-site foundation training. On-site foundation training is the trainings which is happening in Pallam, India. Then we have some pain-free hospitals. There's a few numbers. Then faculty development programs is the medical institute where the faculties are trained, and later on they train the students. And then we have Hamrahi sites, which is actually Hamrahi is a project which is, we are working with the Australian Palliative Link International for mentoring palliative care centers across India. So, as of today, we have 15 sites and hands-on training. So I would like to stop for a while here. Hands-on training, in every state, we have some selected hands-on training partners. So as Radha ma'am was saying that after the training, because this is all online, so you can get back to your, the list will be shared with you by our training team, that in your state which are our training hands-on training partners, and then you can visit them and we'll help you with that also, like how to coordinate. You have to just get in touch with your regional coordinators. They'll guide you that how to reach the hands-on training partners. So that's what Radha ma'am, anything you want to add here regarding the hands-on training?
See, the only thing I keep telling, minimum 5 days or 10 days, I would recommend each and everyone to please do that, because see, you've all had enough knowledge, okay? Even to see one patient with whatever symptom or issue that you have learned through this program will stay very sound. And one more thing I can definitely say, it will improve your confidence. Oh, I have seen some patients like this. So you should pick up a center which has maximum number of patients. That is one simple clue I would like to. Don't pick up a very small center, only one service is available. See, you want to be a master, what should you do? You should cover everything. It may be slightly little bit far away or something, but please do a 5-day in-house, 5 or 10-day in-house in either place. You want to go to Trivandrum and do, very good, that's also fine. But nearby, there are many centers which are good, depending on the state. Get in touch, find out, and please do 5-day program. At least that will be very good for you, so that you all can practice and do something. If you're really interested, that is the way forward. Thank you, Sunanda.
Thank you, ma'am. Thank you so much. Yeah, I think we are done with it. So this was the last slide. I will stop sharing now. And even though those,
there are 2 questions in the chat box. Let me read, Sunanda. Do we have any connection outside India as well? May I know from where this person is asking?
Mumbai. She's Mumbai, from Mumbai, Apurva ma'am. Yeah. Ma'am, you'd like to answer this?
No, that depends. Like, see, again, you get in touch with Palliam. They have a lot of links internationally. Palliam will give answers for that. I think US also they have Palliam Inc. also in US.
Ma'am, why
So
I'm
there
asking is because soon I'm going to get relocated to Canada. So I just wanted to know, do we have anything there where we can actually connect and get more like be more skillful in learning more about palliative care there?
Yes, I think Dr. Zimmerman is from Canada. They have Kamala Zimmerman. There's a palliative care physician from Canada, and they also ESCO or ASCO, some program is there, which is based in Canada. ideally, I would say get in touch with Pallium.
Okay.
I have met the
The
person.
current global fellowship which we are doing is in association with the Queen's University Oncology Department at Canada itself. And that is just an unofficial info from my side. And
That's
yes,
all.
of course, Dr. Apurva, if you
Exactly.
are shifting, we would definitely love to see you starting something there representing us. We would definitely love to have that as well. You as the pioneer there helping us out and collaborating. with
Shripriya ji, I'll
As I-
definitely get connected with you on this.
Exactly. Get in touch with Shripriya because research many things Dr. Zimmerman does. So she is from Canada, if I'm not wrong. So there are contacts. So you just get in touch and then accordingly they will put you in the right place.
Thank you, ma'am.
Thank you.
I think there's one question about a list of hands-on training. Shripriya, are we providing that?
Yes, of course, that will be provided by month beginning, next month beginning. I am meant to collate it once that is done. Hopefully, just after this batch last session on 5th, we will definitely be sharing.
And there's one more question. Do Pallium give hands-on training in Trivandrum throughout the year, any other places? So, Radha ma'am?
Other places is what Shripriya is going. See, every state there are at least, see, total number is 54. Okay. And each state at least has 2 or 3. So for that is 54 for whole of India. And then for Trivandrum, they do have, like, see, if you want to do a full program only, you have to go in the specified times. They run full in-house programs also, because one was started on 2nd of March. So those type of programs will be going. That's again a full 21 days, something like that. But if you just want to do hands-on, you have to get in touch with Pallium, and then they will organize 5 days or 10 days, whatever you need. Is there any specific time, Shripriya? Just add on any information.
For hands-on on-site training, we have specifically 2 types. One is the 10-day on-site training, and one is 6 weeks on-site training, which are schedule based. The schedules once announced will be definitely available in Pallium India's website training calendar. So right now we are going to launch 2 batches, one of the 10 days and one of the 6 weeks. The schedule is already available in the website. And in case you want to just do an observership, that option is also available. Like for say you want to observe what are the activities going on in Pallium India's IPOP and home care for say 3 days or 1 week. Definitely that is an all-year option. Only thing is you have to get in touch with the concerned person well before to get the arrangements done. So anybody who is interested to do any of these can definitely get in touch over a private message, and I will be sharing the details of the concerned person. That is how it works.
Thank you, Shripriya. So I think
hope that's clarified.
Yes.
What was the query?
Hands-on training. Is there any other query? Any other questions? I can't see anything in the chat box.
Nothing more in the chat box, Sunanda.
Okay. So I think I'll thank all of you for your patient hearing, and I hope I have done justice to the session. Thank you very much.
Yes,
Over to
Sunanda,
you,
really.
Shripriya.
You have, because this is also equal, this is something, see, knowledge, skill, everything they get. Then these are the queries, know what do I need, how do I do? And getting the RMI is very important. Not you are all going to have a separate session on opioid availability, in which, see, with opioids, there are many things. Some specialities of our medicine fields, you may be aware. See, with opioid, you have to be, it's just a discipline. 2 people have to sign. It has to be the documentation is also important. So if you're aware of it, fine. Otherwise, you need to do it regularly, because you should never burn your finger with opioids. So that is one important thing to keep in mind, which will be taken in detail when you have that session. So main thing is that Pallium is with the regional coordinators available for each part of India. It's not, you may not get this type of assistance from other places. So you could utilize it and successfully do something, either as an organization or as a team. So really very, very helpful to take them through this, Sunanda. Thank you very, very much.
Thank you so much.
Because this is also very essential part of their whole program.
So I think I would just, I want to add on that, yes, it's true that we will have so many questions even after the session also. So it's better that you connect with the training team and they'll guide us as per your state. They'll guide us to the concerned regional coordinator for all your queries, all your questions. You get, you can call us and write to us. So we'll guide you step by step. Even if it's a very simple question, we are there to answer you. So please feel free to contact all your concerned regional coordinators. Thank you. Thanks, ma'am.
Silly
Thanks.
questions, simple question, anything is fine.
Anything.
Because always better to clarify rather than be in trouble.
Shripriya, over to you.
Yeah.
Thank you.
Anything
Just
else?
that, as the saying goes, a journey of 1,000 miles begins with a first step, and we are definitely there, the facilitation team and the training team, to help you with the first step. So we are together with you. It is not like that we are walking behind you or we are leading and showing the way. It is nothing like that. It is just consider us as we are with you together in this. And yes, as Sunanda said, the facilitation team is all, I would rather say they are available even off the duty hours. Many a times I even trouble them with messages on Sundays and public holidays, and they have been very kind enough to respond as well. I would remember that kindly at this time. So yes, whatever queries you have regarding this particular concept of organizing palliative care services in your particular region, in your particular setting, please do get in touch with us. Our duty is primarily to help you, facilitate your dreams come true. So Radha ma'am, with your permission.
All four, see, one more thing I'll add on. All the 4 coordinators, okay, all coordinators are very good. Okay, I've seen and met all of them. So Sunanda is like an example to show how the rest are. Okay. So it's really, I'm not, see, wholeheartedly I'm telling, I have had the opportunity to meet all 3 of them. Ronto, Rajendra, Aarti, Lalit, all of them. Okay. So for all 4 regions, they are there, and then they will take you, as she said. See, she gave you an example of what she did with Fortis in Mumbai. So exactly that's what, see, from the beginning, oh, I've got this idea, this is what I would like to do. Get in touch. Then they will take you, because there are many steps. As I said, no, everything is needed. But if you don't have, I think as doctors, you are all aware. So you have to plan, prepare, and then you decide and then go ahead. So without planning and preparation, your final product will not be very good. So that's very, very important. Yes, Shripriya, I think as there are no more queries, I will hand it over to you.
Thank you, ma'am. So I believe everyone can grab their cup of evening coffee much earlier today. We are winding up 15 minutes before the time. Thank you everyone for joining in, and with the promise that we will be again coming back to the medical topic in the next session with another eminent faculty. This is Shripriya along with Ms. Sunanda Samal and Dr. Radha Venkateshan signing off from the Tips Echo Hub with Mr. Anup joining. So thank you everyone. See you in the next session. Till then, everyone take care. Bye-bye.
Thank you, one and all.